Hello everyone, this is Anil Khwaja here. We are on our third consecutive seminar. This seminar is on AHPRA and Skill Assessment for NMAC. So those who are health professionals wanted to get their skill assessment done uh, from the first step towards the AHPRA registration, and then if you are nurses or midwives, then you need to get an NMAC skill assessment done as well in order to apply for the permanent residency. So we'll speak about all the processes, how things works out, what application needs to be submitted, what are the streams, what are the documents required in order to apply for NMAC, and how we're going to have the next pathways for that one. So let's start with the NMAC first. So if the team can put up a slide for me here. All right, so before we start, the additional benefits for this seminar, obviously discounts on the PT portal, then you would get a good goodie bag. Who have just joined us here face to face, they'll all get the goodie bags. Then we have one-to-one seminar session with me as well. Being a migration agent, I can help you out putting up the plan in and then submit your applications. Then there is a 25% discount those who would be joining us here. So we definitely will honor whoever has joined us live as well as to the Facebook face-to-face. We will be giving them maximum to 25% discounts, but those who are here at the face-to-face, they'll get exact 25% discount on their presence. So let's go to the next slide. So rules of the session, you need to stick with the topic. So today's seminar is all about AHPRA and NMAC. So you need to ask questions regarding if you're from a nursing background, especially this session is for the nursing background. And even if you have any other questions, I'm more than happy to answer you at the QA, the session which would be held at the end of this seminar. Then again, I will be asking one question as well. There will be a quiz question. If you feel like you have the right answer, we'll take your question, and then from the lucky draw, you'll be getting a surprise gift from us. Your gift would be announced at the fourth day of the last day of the series of seminar. So stay tuned. Keep yourself updated with all the skill assessment. Do share our seminars to your friends, family, and whoever wants to migrate to Australia. Or if they are in Australia and they belongs to a nursing background, this will help them out. So make sure you do share and like our page, because we try educate as much as we could to all our audiences, our potential clients, even to the existing clients. So let's start. So NMAC skill assessment. NMAC stands for Australian Nursing and Midwifery Accreditation Council. So that's called the NMAC. So who they are, it's an external accreditation entity by Nursing and Midwifery Board of Australia. This is also that they also call it NMBA. And the agreement of AHPRA. So AHPRA is the registration agency. So with the help of the Nursing and Midwifery Board Board of Australia, they have accredited NMAC to do the skill assessment for you. So this is how it works. Most of the pathway requires to have an AHPRA registration. So if you do have AHPRA registration, your NMAC skill assessment would be very easy. Though the AHPRA registration itself is a very daunting application process, but we'll try to help you out. We'll educate you how the process works. So it's going to be easier for you to then work out on the pathways. So three main pathways. One is the modified skill assessment. The other one is the modified plus skill assessment. And the third one is the full skill assessment, those who don't have an AHPRA registration. So we'll go for a quick break. After the break, we'll discuss about all these options and what are the document requirements for this one. Thanks. Cheers. All right, thanks very much. I'm getting lots of questions on my WhatsApp. So just trying to put them to one of my books. So at least by end of the seminar, we can reply them. So let's start with the first stream. So yeah, so before the first stream, we will be discussing about the AHPRA registration, how that works. So the AHPRA, as I told you, it's an agency, regulatory agency, which does the registration for health professions. You can name it, all the occupations comes under the AHPRA registration. So if you are doctors, it's the medical practice doctors, or radiologists, or medical radiation practice, nursing, midwifery, optometry, occupational therapy, these all comes under the AHPRA. AHPRA is it's the umbrella, and then obviously they have allocated to different bodies to get their skill assessment done. So this is the first step. If you're going with AHPRA registration, you need to then apply. They require certain amount of experience. They require certain amounts of documents to go for. So let's look on the process of AHPRA, how to apply. So next slide, please. So as we said, there are a couple of different, registration requirements. The first one, the more common, is the general registration. So general registration is for graduate application and those who are internationally qualified nurses and midwives. So two obviously are there, and the second is a provisional registration. So say if you are one of the accredited country graduate, then you might have a provisional registration that can also help you to apply the full registration while you're here. Obviously, there are certain requirements to meet. Once you meet that one, you'll able to apply for the full registration. Now, mandatory registration requirements are that you must have your character records quite clean, so no criminal history, nothing. English skills requirements are there, so you need overall 7, no less than 7. You can take English in 2 subsets as well. So for instance, if you have done English IELTS back to back 2 tests, and you have achieved 7 in reading, writing, and 7 in speaking and listening, you can still merge that one in order to get your AHPRA registration start. Same goes with the PT, Pearson of test, OET, and you name it. So these all are tests, they are accepted. So you just need to make sure that at least you have overall 7, no less than 7 in all modules, or equivalent to PT. Generally, the PT is 65 overall with no less than 65. So that's the English requirement. Then you must have a continuing professional development. So you need to have certain amount of experience. So number of hours are there. Once you meet that one, you would able to apply. Then you also need a professional indemnity insurance. So that can be submitted down the line after getting the registration, or you can have a tentative indemnity insurance from lots of Australian indemnity insurance organizations or companies. They're offering that. So you can contact this for Think as well. We can able to assist you getting that one. Then the last one is the recency of practice. So you must be practicing. So you must have a license in your home country in order to apply that registration. Along with, you must have recently been practicing nursing, no matter a junior nurse or a trainee nurse or a full-time nurse, but it needs to be practicing nurse. Yep. Let's go to the next slide. Now, eligibility for graduate registration is quite easy. Once you finish the Australian qualification, you can apply even before getting a completion letter. Say your completion is about to finish in next 4 months, 4 weeks, sorry. So you can still apply for the AHPRA registration prior to having a completion letter in hand. That's good. This is because they have heaps of application and they don't want you to have any disadvantage not applying earlier and then miss any state sponsorship applications or any PR pathways. So make sure you do this one. If you're, studying either a diploma of nursing or bachelor of nursing, still you can apply just before finishing that one, like prior to finishing, at least 4 weeks prior. Now, document checklist is quite easy. Identity documents like passport or driving license. Visa requirement is there. Obviously, you must have an Australian qualification which is AHPRA approved. So without the AHPRA approval qualification, you cannot apply for graduate entry. Then police check, obviously Australian Federal Police is required. And the last but not the least, English proficiency, which I've already explained here. Let's go to the next slide, please. Now, AHPRA registration for international qualified nurses and midwives, this is the tougher task. For graduate is quite easier, but for international nurses, there are couple of steps you need to do it. First is foremost is to make an account there and do a self-check. Self-check will allow you to know which pathway you are going for. So self-check is an automated test. They will give you a pathway whether you're going with a stream A, B, or C. Once you know what stream you are after, then you decide to apply for an application. Say for in stream A, if you qualify for the stream A, then team, if you can go back one slide back, and please team, just wait for my instructions before you go further. All right, so stream A, QNM. So who will, obviously, if you are qualified nursing and midwifery from a substantial equivalency from AHPRA, then based on a similar competencies, you would able to apply for stream A. That is the quickest one. Once you get that one, then you normally get a provisional registration, and then you need to come down here to have a face-to-face ID documents to be verified, and then you get a full registration. That's the quickest way to do it. Then stream B requires you to have an MCQ test and then an OSCE exam. So these two exams needs to be done if you fall under stream B. MCQ exams can be taken overseas as well. There are specified centers out there, but mainly AHPRA has more of their centers in Australia. They seldom do one or two tests by overseas. So you have to do MCQ, and then you have to do an OSCE exam, which is mainly in Australia. Now, if you want to do exams, then you can either apply for visitor visa or any other short-term student visa in order to come here and do the exams. Otherwise, it's going to be really tough. There is another visa called 40 to 407 that also you can apply, but that requires you to have an AHPRA letter and depends on your country risk rating, whether they're going to give you that visa or not. But yes, these are the options you can opt for. Stream C is especially for those who won't qualify for first two streams. Obviously, you need to then, if you're not substantially equivalency, then you have to just follow the stream. There needs to be a qualification. You need to do it. Either you'll ask you to do a bachelor's of nursing, or maybe a grad diploma or a master's, whatever they, advise you need to do the qualification accordingly. This is how it works. Now let's go to the next slide. So before the modified skill assessment, let's take a quick break. Let's have a water break. Once I'll be back, we'll be discussing about what documents require modified skill assessment course. This one is for those who have recently done Australian qualification. They have a couple of months of experience, and then they need to apply for direct modified skill assessment. Very good for them. So let's first get a break, and then we'll come back and discuss about this stuff here. All right, welcome back, viewers. So let's start with the modified skill assessment checklist, and then we shall be discussing about the other streams as well. So NMAC modified skill assessment, those are already registered with AHPRA and NMBA. They need to apply for modified skill assessment, must hold a current registration in Australia. Document needs to be at least 600 dpi, so make sure that you're properly scanning that one. Passport, a name change document. If you're married, you need a marriage certificate. If you have ever changed the past name, you must need to have the stat declaration as well, because sometimes in year 10 or 12 you have different name, whereas in university or while making a passport you have another name. So you need to have a stat deck with all the name variations. uh, Passport size photograph needs to be there, so you can take it on any background, as I spoke yesterday as well. Take a phone, go to any white background and take a passport size photo, and that will do. You don't need to go to the hospital and get it done. Yeah. Save some of your money. Yeah, that's the tip. So academic documents, both overseas and Australia, requires properly scanned. Awards, transcript, work experience. So as I told you earlier, for modified skill assessment, you require at least 3 months. That's 494 hours of work experience for occupation other than non-else classified. So for instance, you wanted to a registered nurse aged care. As you said that lots of state sponsorships, especially in Victoria, they said that we need only aged care nurses. Now for that, you specifically need 494 hours of work experience. Otherwise, you'll get a general registration if you have studied in Australia. If not, then you have to finish the study work experience in order to apply for the NMAC skill assessment. And obviously, you need to do a registration verification. It's pretty easier if it's an AHPRA registration. NMAC will do it directly. You don't need to worry about doing a registration by yourself. Registration verification. And the last one is the agent declaration. So you need to fill an agent declaration if you have hired any migration agent in order to apply the skill assessment. Let's go to the next slide, please. Now, the second stream which we have discussed is the modified profile. Sorry, team. So NMAC modified plus skill assessment. For those who haven't studied in Australia or New Zealand, Australia, they can apply for a modified plus skill assessment. You need a notice of in principle approval of registration from AHPRA. Generally, they have specific countries to which, if you have done nursing, they can issue you this letter. Once you have this one, you can apply for modified plus skill assessment. This is not for the enrolled nurses. Let's take a quick break and we'll come back after the break. Thank you.
Hi, this is Siva Santosh. I would like to thank Think Higher on approval on my 491 visa, New South Wales region. Of all the time I was residing in regional New South Wales and they were in Melbourne, and we contacted over the phones and emails and the process went really smooth. A huge shout out to Malik, man, the way you contacted the case officer and getting the nomination approval was really appreciated. So I highly recommend, guys, please go and visit Think Higher. Thank you.
Hello, I'm Ibrahim. I received an unfortunate ban of 1 year by Engineers Australia. Then I contacted Think Higher Consultants for a professional advice. They are one of the best consultants in Australia. They were always available to talk, kept me updated on the process. I will highly recommend them.
All right, welcome viewers. So let's go with the next slide. So now the full skill assessment is for those who have not hold any AHPRA skill assessment registration in Australia. They need to have minimum bachelor's degree or higher in order to meet the requirement. Or if you have a bachelor of nursing qualification from these specific countries, so Canada, Hong Kong, Ireland, UK, and US. Apart from that, you must not you cannot apply the full skill assessment. So these are the countries where you need to have your qualification been done. Now you must need to hold a registration in your country as well, these 5 countries. For register midwife, if you do not hold a registration in Australia but have a minimum bachelor's of midwifery qualification from Ireland, United Kingdom, or United States, still you can apply. But again, you need a full registration in your home country as well. For enrolled nurse, obviously for enrollment, this is not the stream. You cannot qualify with this one. So unfortunately, you cannot apply. The last one is the same, the checklist, like, the passport, educational documents, IELTS requirements. So these are pretty much the same. But say if you have done a 5-year study in UK, US, New Zealand, and 2 more countries, which comes under the top 5 English speaking countries, then you don't require any IELTS or PTE to be submitted. So these are the requirements for applying for full skill assessment, but you need to ensure that you fall under these 5 countries in order to apply. Otherwise, just apply for registration first from AHPRA and then go with a modified skill assessment. That's the quickest pathway. Let's go to the next slide. All right, so that's pretty much it. So team, if you can put the, let's go to the, let's go to a quick, very short break, and then what we're gonna do, we'll put up a QA session now, and whatever questions you may have, you can ask me after that one. Thank you. Alrighty, so any questions you may ask right now, more than happy to take the questions. Meanwhile, until we get more questions, I have few on my WhatsApp as well, so I'll read that through. Before that, just for those who watching us from Pakistan, my team is currently doing a 476 event at NED University. So if you're interested to know your free eligibility criteria for 476, you can visit them, ask them for the information. They're more than happy to assist you in that one. Another super news which we have disclosed like day before yesterday, we have also started services for UK. So we would be providing student visa services, admissions, health insurances, and postgraduate visa. So if you're interested in UK, feel free to contact my team. We have all the education providers, all universities under us, and we're more than happy to take your applications. So let's start with few questions. I think we have got few. Team, if you can put the first one. All right, so Shoaib Abbasi has asked us about any idea when New South Wales is going to announce their list. Most probably, Shoaib, I believe the first week of August, because that's where generally they do it. Last year, also they have started, getting applications in the month of August. They introduced a new ROI thing. So I'm pretty hopeful that this year it's gonna be on first week of August. So stay tuned. They may announce the new updates, whatever the changes needs to be done into the policy by end of July. We already, on 21st of July today. So most probably in a week's more time, you'll get the policy out. And then from the 1st of August, you would be having more clear, understanding of how the New South Wales state sponsorship is going to work. All right, so Malik is asking, is there any exemption to English requirements like getting scored into exams? Yes, exemption is where you have studied in Australia for 5 years and you don't require to submit any English to NMAC. Whereas, as I spoken last time, if you have attended 2 tests together, for instance, IELTS, you have done one back to back, and then in one of the tests you have got 7 in reading and writing, and in next you have got 6 in the same reading and writing, but in speaking listening you have got 7 in other tests. So you can combine all together, make it 7 each, but make sure both of tests you must have overall 7. So say if in one of the tests you have 6.5, then you won't be able to apply. So the requirement is to have overall 7 in both tests, and then you can merge into 7 each, keeping the fact that they require, the IELTS needs to be done back to back. In some instances, you can also collect 2 best tests you have given it. So say first and fourth, third, or second or third. So it depends on you, whatever you want to do. So AHPRA or NMAC won't check IELTS that how many attempts you have done it. You can take 2 tests. If they are within the 2 years time, you can still submit that one. All right, one more question. I've got it from on the WhatsApp, that how much time it takes to get the graduate skill assessment done if we have already studied in Australia. Generally, they take time from 4 to 8 weeks. They're pretty quick these days, but take it at least 8 weeks in order to get the outcome. As soon as you get the outcome, then you would be able to apply for any permanent residency application, especially for general skill migration. We'll wait for a couple of more minutes and see if any other questions may have it, but I'll check my WhatsApp if needed be. All right. So Shoaib Abbasi has asked another question. Let's take that one. Thanks, Shoaib. So is upcoming year going to be a good one? Will they start inviting more? Or will they follow the old procedure? For engineering, how many points you ideally see? Shoaib, as you know, there are lots of engineering fields. So most likely, what I have believed that electronics would still struggle. Telecom network engineers or electrical engineers, mechanical, civil, they will have more opportunities. Even for the biomedical engineer, points I would relate that if you're going with a 190, then it's going to be 85 to 90. Whereas if you're going to go with the 491, then you have to meet the certain state requirement, the region requirement, and it sometimes they also invite you on 65 points as well. So 491 is easier compared to having a small lesser points, but obviously you need to meet the requirement. You have to go in a regional area. Whereas for engineers, 85 to 90 points would be more safest one. And the other question you may ask, whether they would be inviting more or lesser, or have a same old procedure. From my point of view, this year would be better compared to the other years. You'll get more migration. So more migration means more invites, more opportunity for, especially for onshore, because they haven't giving any policy for the offshore applicants as of now. So onshore, and then obviously for offshore, so you have better opportunity this year. Malik has asked another question. Can I apply for graduate assessment if I have completed the qualification but still waiting for the completion letter? Yes, Malik. So you can apply. You can apply at least 4 weeks prior to completion of your studies. That will save your time. That's what the NMAC policy are, in order for those who are graduates or will be graduating in near future. They can apply prior to 4 weeks of their completion. All right, thank you so much, viewers, for coming in. Shoaib, if you have any other questions, you can ask. More than happy to answer. Otherwise, we'll wrap up this session for today. Alrighty. So thank you so much, guys, for watching us. Stay tuned for tomorrow's seminar. So tomorrow's seminars would be the last of the series. We would be discussing about VETASYS, which is, I think, one of the quite famous skill assessment body, and we have lots of expression and interest for that one. So hopefully see you there, and inshallah we'll speak tomorrow. Have a good day.